I think I was very drawn to the idea of making sure that our mission was about supporting those people who were called to try to make change in their own countries.
One of the things that non-resident immigrants often talk about, and as you mentioned, have a problem with, is the healthcare system in the U.S. and how expensive it is, and how challenging and tricky all of that is.
The future in the next few years to the next decade, I hope we will settle on a model that really does put local leaders first and really is responsive to their needs, while also recognizing that there is a role for international organizations to make sure that evidence is being generated and shared.
Hello and welcome everyone to Global Minds, the Harvard Alumni for Global Development podcast. This is your host Bibek. Here in Global Minds, we invite global development professionals from different walks of life and talk about their experience and journey of trying to make this world a better place. Today, I'm very delighted to have with us Gina Lagomarsino, the CEO and President of Results for Development. Thank you so much for joining us, Gina. Welcome.
Thank you, Bibek. It's great to be here.
The pleasure is all mine. So before I move on to my questions, I'd like to give a short introduction of Gina to our audience. Gina co-founded Results for Development, or R4D, in 2008 and became CEO in 2016. Since then, she has led the development of a new organizational mission and strategy that puts change agents, public, private, and civil society leaders squarely at the center of R4D's work and aims to improve upon traditional global development approaches. Throughout her career, Gina has focused on expanding health coverage to low-income populations. She has done this by coordinating a global task force on universal health coverage, authoring articles on the subject, and building networks of policymakers in low and middle income countries. Prior to her work in global development, Gina spent a decade working to improve health systems in the United States, including as a senior health policy advisor to Washington, D.C. Mayor Anthony Williams. Gina holds an MBA from Harvard and a bachelor's in public policy from Stanford. Very illustrious and impactful career, I must say, Gina. Is there anything?
Thank you for that very comprehensive intro, Bibek.
No, I'm glad I covered a lot. But is there anything you'd like to add to that might be relevant for our conversation today?
Oh gosh, I think you covered most of it. I would just say that most of my career I've been really fascinated by health systems and increasingly education systems. They're complex. They take a lot of different stakeholders to make them work well for people. And I've always been intrigued by how to make that happen through policy and interaction with the private sector. And more recently have gotten really interested in how to make global development more effective, the field. So I'm excited to talk more about that.
Yes, definitely. I'd love to touch upon some of those things you mentioned later in our conversation. But you mentioned, how you're interested in public policy, and maybe we can begin with that. So why did you choose public policy in the first place to study? In college, you could have chosen any other subject, but was there anything about your upbringing or any formative experiences that, got you interested in public policy?
That's a great question. So I know my parents were kind of children of the 60s. And I remember my mother always quoting John F. Kennedy, that, you have to find a way to make the world a better place. So I sort of grew up with that in my mind, that I wanted to do something that would improve the world. My parents were actually teachers, both of them, and many members of my family were teachers. So a lot of folks that I was around were involved in very direct service. And I did, experimented with that as a young person. I even experimented with the idea of law. I worked one summer for the federal public defender for the Western region of the United States. and got to see some interesting cases. But I think it was during those experiences that I recognized that my interest really was at the kind of systemic level rather than at the individual service level. I mean, obviously, individual service is incredibly important. But for me, what really got me passionate was how do you figure out how to make the system better so that you can affect the lives of many, many people, rather than just one at a time. So I think that's what
Mhm.
ultimately drew me to public policy. And I think in the early days of my studies, I was drawn to different areas of policy. In fact, I did, when I was in college, I spent some time in Washington. I ended up eventually here, living here, but was doing an internship, and I was working on international trade for a while. So that was an area that I was kind of intrigued by, but ultimately got drawn into healthcare, partially because there was just a lot of discussion about the U.S. health system at the time when I was in Washington back in 1994. Not
Mhm.
to date myself here, so I think that's what drew me in. There was at the time Bill and Hillary Clinton were in the White House, and they were making an attempt to reform the U.S. health system. And at that time, I got a chance to go work on Capitol Hill for the late Senator Ted Kennedy, who was the chair of the committee that was really working on the healthcare reform bill. And the entire bill kind of crashed and burned and failed that summer that I was working there. That was an incredible lesson. But I think it drew me in that there's
Mhm.
this potential to create these kinds of reforms that can help a lot of people. So I got very interested in how that could happen.
Right. No, thank you for walking us through that. What got you interested, and that was going to be my next question because right after college, you seem to have started on healthcare policy. I was going to ask, why particularly healthcare? And you mentioned it was the topic of the time. There was a lot of discussions going around, but was there anything other than that was being talked about that got you interested in healthcare, especially helping low income people
Mhm.
get access to proper healthcare?
Yeah. So I mean, one thing I should say about myself, I'm absolutely not clinical. I never had any interest in being a doctor. Maybe in part because of what I said before about the direct service, but that aspect of it didn't appeal to me as much, the medical side. But I do remember this was before I spent my time in Washington. I remember very clearly sitting in a lecture hall when I was about a sophomore in college, and there was a guest speaker, a guy by the name of Alan Enthoven, who had been an advisor or was an advisor at the time to the Clintons, who were starting to work on health on the U.S. health system, and he was talking about some of the problems in the U.S. health system, the fact that you had third party payers that were paying, and individuals and doctors didn't always get to make their own decisions about medical care, but also the fact that um, they also didn't also necessarily feel the effects of the costs of medical care. And so I was just really intrigued by how the US health system was set up and how complex it was, and the opportunities for potentially making it better. So I think I was intellectually drawn toward this. And the US, like many other countries that I work in right now, is a large, complex country with lots of different layers of government at the federal, state, local level. There's a lot of private sector hospitals and doctors, and they all are influenced by policy. And I found it really interesting to think about how you could use policy to influence all those different actors toward goals, like trying to make sure that low income people have coverage, that there's equity in healthcare, that the costs don't rise so much that the country can't afford it. So that was, I think, where I got like sort of intellectually switched on. But healthcare also sort of stimulated the side of me that felt like I could help people too. So I think it was
Mhm.
both a sort of heart and head
Yeah.
pull on healthcare.
Right. And then you eventually got to sort of work on both as an advisor to the mayor of Washington, D.C., to work on policy as well as a chance to really impact a big group of people, and also work in a systemic level, which seemed to be your interest. Could you tell us more about that experience and possibly, well, for one thing, thinking about what it takes to bring change in a systemic level, but also, what is it like working in a government level, in a local government body, versus working in a private level, for example.
Sure. Yeah. Well, gosh, that job I had working in DC, Washington, DC government was really fun and very formative for me. And just for context, I had spent the first couple of years of my career working for Kaiser Permanente, which is a large private health system, very strong in California, but they have entities in different parts of the United States. And it's a great system that does kind of financing of healthcare, sells insurance, but also provides healthcare and has a whole physician side of the organization. And I had the opportunity to work for both. So there was a real opportunity to make change for the people in that system when I was working there. But I think working in government was totally different. And the role I played, I was a pretty young person. I got very lucky to have this role, but I was working at the intersection of kind of politics, policy, and implementation in, Washington, D.C., as you may know, is the federal seat of government for the United States. It's not part of any state, or it is, so it kind of functions as a state and a city and a county all rolled into one. And it's not that big. There's less than 1 million people that live in Washington. Sadly, there's a large percentage of them that are low income. And before I got into my role, we were really failing the low income population of Washington, D.C. in terms of both financing for and healthcare and access to high quality hospitals and doctors. So there was a huge opportunity, and there was also a window of opportunity politically that I entered into that was very exciting, where there had been a decision made to basically shut down the public delivery system, a big public hospital and some clinics, because it was failing people medically, and it was also really had serious financial problems. And that had been a major political fight in the city. But I got to come in after that and help to design a new approach to providing care to that population, which really involved, for me in that role, doing a lot of really trying to understand what was going on in the city, what were the assets that the city had, like such as a big network of not-for-profit health centers serving different populations, and some good, strong hospitals that have been serving the higher income population. So I got to look at that. I got to look and see what was working in different cities around the world, and states, and then also really do a lot of work with the stakeholders in the city to better understand what was needed. And so I think what I learned there, was a really exciting time to be able to work with all those stakeholders to design a program that was funded by the city. So it was free for the people that were involved, but would offer them coverage for people that were below a certain income level. It also offered coverage to people that didn't get care from the federal government at the time, like people that were undocumented immigrants, homeless adults, things like that. So I think I learned this lesson of how you have to bring together all those stakeholders, look outside for inspiration and evidence, but also look inward for ideas, and then bring people together around a solution. I also had the benefit of, Washington, D.C. has a whole bunch of think tanks that mostly serve federal healthcare policy and other kinds of policy areas. But many of the people that were sitting in those think tanks, like the Brookings Institution, the Urban Institute, RAND Corporation, they were eager to help. And so I was lucky to have really great advisors who had a little bit more experience than me and knew the policy really well, who came in and supported me, but also allowed me to do my work. So it was a really exciting few years. I was excited that we were actually able to design and pass legislation to implement reforms and get it started on the implementation process, even in the 3-year period. And I think in part, because it's a small, I encourage anyone who ever has the chance to work at the sub-national level to think about it, because you can really make change quickly in a smaller jurisdiction like that.
Absolutely. And it seems like some of the threads that you sort of learned during your time in the city government, working with stakeholders, building solutions from within, those are things that I see has transferred to your work in results for development as well. And I'd love to talk more about that in a
Sure,
bit.
yeah.
But just thinking, so I've lived in DC, and I'm as a non-resident in the US. I studied and worked there for a while, and now I'm based in Nepal. And one of the things that non-resident immigrants often talk about, and as you mentioned, have a problem with, is the healthcare system in the US and how expensive it is, and how challenging and tricky all of that is. But you have worked to improve healthcare systems in the US as well as in other low and middle income countries. And I'm curious to know your perspective on how do healthcare systems compare, in these different contexts. And would you say the challenges and opportunities for universal health coverage are similar, or are they vastly different in the U.S. compared to the low and middle income countries?
Oh, what a great question, Vivek. And I would love to ask your thoughts on that too, since you've been in both places. First, let me say, I always joked when I started working in global development and I was meeting people from around the world, I would say, well, I helped solve all the problems of healthcare in the United States. So now I've moved on to the rest of the world, which of course is meant to be a joke because
Yeah.
the US health system still has many, many problems. But I think it's interesting. I feel like there are some things about the U.S. that are really unique, and there are some things that are very similar to a lot of places. And let me maybe start on the similarities. I think, especially working on some of the implementation work I did at the D.C. when I was in D.C. Um, a lot of the challenges of trying to figure out how do you um, fund care for people. What's the right approach? Do you use tax financing, or do you make people pay into insurance system? Those, if people are not in a formal workforce but they have some income, how do you get them to pay in? How do you get them to buy it? Like those, I think, are kind of, that's a problem that the U.S. faces and a lot of other countries face. I think some of the challenges of just figuring out how to implement public health are really similar from in the U.S. and elsewhere, trying to get to people to make sure they get their preventive and promotive care, et cetera. So there are a lot of similarities. I think what I I have found sets the US apart a little bit. I feel like politically, if you look broadly in the US, one thing that I have always scratched my heads about is that the concept of universal health coverage is actually controversial in the United States. Some people sort of don't believe in it. And I've not been to any other country in the world where this is a controversial topic. Like
Mm.
in other parts of the world, even when you have conservative governments, everyone will say, well, of course, our goal is to get to universal health coverage so everyone has access to healthcare. They might disagree across parties about how to do that in different contexts. I feel like in the US, it's actually controversial, which I have never quite been able to totally understand. Interestingly, as an aside, the concept of universal education is not controversial in the US. We've always accepted, most people at least, I think in the US, accept that the government should provide education to all kids. Some people might think that maybe they should offer vouchers for private schools, but at least the funding of education, people don't say, well, you should have to pay for your own schooling. In other countries, it's almost the reverse. You see less support for government funded education in other countries. So I don't know why that is. That would be an interesting
Mm.
sociological study to someday try to figure out. Um, and the other thing I would just say is the US is a very highly privatized system. And that is not unique. I've always been intrigued by, for example, India, Nigeria, Indonesia. These are countries that are big and they have lots of state jurisdictions, and they also have lots of private sector um, entities providing care. And so I think there are some similarities across some of those large federal countries, but quite different than some, probably a bit different than Nepal where
Mm.
you are. So although I'm not someone that's very familiar with Nepal, so you'll have to educate me about.
No, yeah. And I think the point you raise is very interesting that, universal health coverage, while it's debated in the US, education is not. Whereas elsewhere, for example, I did my schooling mostly in private schools, which is very common, in this part of the world. So, yeah, that's very interesting. But moving on, I think we touched upon this your work that you're doing in low and middle income countries, and I think I want to connect this to how the results for development got started. And since you were one of the original co-founders, could you walk us through the initial days? What was the need that you saw, your team saw, and then what was the gap you were trying to fill? What was the kind of development that was missing that you were trying to do through this organization?
Thank you. Yes. So I can't talk about the beginnings of Results for Development without talking about David DeFerranti, because he was our original founder, the person that I started working with, who had been at the World Bank in a bunch of different very senior roles over the years. And after he left the World Bank, initially had gone to the Brookings Institution, a big old 100-year-old think tank in Washington, to start a global health group there. And that's where I met him right after I left the DC government. I was term limited out because it was a political position I was in. So I met him and started working with him and a few others. And what I think was driving, especially David at the time, both his desire to go to Brookings and then ultimately fairly soon after that to spin off and start Results for Development, was a desire to get evidence into practice. And I think he had spent a lot of his lifetime doing, early in his early career, doing some research on what worked, and then also working across the World Bank through, all the different World Bank loan facilities and technical assistance to support countries to make improvements, particularly in their health and education systems. But I think he saw that there was a need for more support for those leaders and that some of the large lumbering bureaucracies like the World Bank, which has incredible amount of assets, but sometimes can't always be as responsive, and also can get caught up in some of the politics. And I think he saw a need for an independent organization to really be able to support leaders with kind of their priorities and make sure they had access to the best evidence and data. So that was sort of the early days. Where I was, to be perfectly honest, Bibek, I started working with David. I had no idea that this was going to lead to 15. It's actually been almost 17 years since I started working with him. I was sort of along for the ride initially, and it sort of unfolded for me. And I think for me, I had a light bulb that went off a couple of times. I started helping him set up the organization, everything from just finding our first office space and hiring our first people. But the first project that we got asked to do as Results for Development separately was with the Rockefeller Foundation. And it was, they were interested in exploring the role of the private sector in health systems globally. And at the time, there was a lot of controversy around whether, should there be a private sector in global, in health systems, and what is its role, and is it better or worse than the public sector? And I was really intrigued by this because, as you recall, this reform that I had helped to lead in DC really there was a public system that wasn't working, and it was actually in some ways shut down, but we were able to take public money and purchase care from the private sector effectively, and be able to get care to people. So I had some experience in this realm. I was certainly not kind of some evangelist for the private sector and everything has to be privatized. But I also was intrigued and started to learn more about a lot of countries around the world. The government is very involved in the public side of the health system, often running its own hospitals and clinics. Usually there is a private sector that is kind of there as well, but often not as well stewarded by the public sector. And I had learned that you can make them work better together. So I was like, oh, maybe I could contribute globally. Maybe some of what I've learned in in the US might actually be relevant. And so I kind of got my start on that project, which really led into a lot of the thinking around universal health coverage, and how countries can finance a health system in a way that really provides coverage for all of its people, and also can engage lots of different kinds of healthcare providers. Depending on the system, you might have both public and private. So anyway, so I think the early days, there was sort of kind of David's thinking, and then what kind of drew me into it and got me excited about it. I also for the first time, got a chance to meet people all over the world who had been um, in roles that were really similar to the one that I had just left. And that was really exciting for me. I felt like I kind of met my peer group of people who was like, oh my gosh, were you dealing with, and this is where, Vivek, I really saw where there were similar challenges
Hmm.
to things I'd been dealing with in DC, could be similar to what a state in India was dealing with too. So that's what got me particularly excited, and I think set me on the path to sort of sticking with results for development until now.
Yeah. No, thank you for walking us through that initial journey and motivations and how you got into this work. And I think there's two things I mentioned at the beginning of your introduction, that you sort of have, as a CEO, started this new strategy and approach that puts change agents at the center and improve upon traditional global approaches. Um, could you elaborate on that? How sort of results for development, its approach to development has changed over time, and what kind of development are you looking to do now?
Yeah, thank you. So I think one thing I realized, it was really interesting to go from working domestically on health to global health, because, gosh, the first year or so I was working on it, I was so confused. I mean, there are just so many different global institutions that work on health. There's all the multilateral agencies from the World Health Organization. That's kind of the normative body that sets, recommended policies, and you've got the World Bank that's financing things. You had a bunch of different global partnerships that have been set up recently, like the Global Fund for HIV/AIDS, TB, and Malaria, Gavi, the Vaccine Alliance, and then you've got all these bilaterals, USAID, FCDO, which is also known as UK aid, all the other wealthy countries that give money, and then there's foundations like the Gates Foundation, even private philanthropists, all going to countries saying we want to help, but yeah, we have our own private agenda. Whether it's the U.S. Congress that's pushing something, or the Parliament of the UK, or a particular donor that has an interest, and you've got these poor folks that are trying to actually improve health and education for their people, and they want and need support, because these are low income countries. We could go into why they are low income, and all of the history of colonization, et cetera. But there is I think a need and a responsibility for the wealthier around the world to support those who are possibly poor by design,
Hmm.
from the history. But the problem is you have all these folks coming at them, and with an agenda and an expert who's telling them what they should do. And I think I had been kind of a change agent myself, right? I had been one of these people that was trying to create reforms, and I did have support, as I mentioned, but the support that I got was never like telling me what I absolutely had to do, and with money attached, and like, we'll only give you this money if you do it the way we want to do, and here's our expert. And I wasn't always spending time. I mean, I could say no to meetings if I didn't want to take them in my role. And so I think I was very drawn to the idea of making sure that our mission was about supporting those people who were called to try to make change in their own countries. And I think there is a risk in many global development organizations. I think even the early R4D, this was a problem that I was trying to solve. You get very focused on the donors. Who's going to give us money? What does Gates want? What does USAID want? What does the Rockefeller Foundation want? And you as the global development organization, get focused on raising that money, working with those donors on creating the program, and you forget who you're really trying to serve. So I think that was driving our change. I think there's a distinction. There are many humanitarian organizations and organizations that offer direct service to people in countries around the world. I think there's clearly a place for that, especially in humanitarian situations. I do think the risk of organizations going in and doing direct service, especially international organizations, is that you can disincentivize or inadvertently affect the development of the systems in those countries to be able to support their own people.
Mhm.
So I think we decided we wanted to adopt this mission that was less around, we're going to go help to make sure the healthcare gets provided and build the schools and train the teachers and do all that, and more focus on, again, back to this policy and leadership. We're going to focus more on how to support leaders to design and implement systems that could really serve their people at scale in a way that is appropriate for their context, build up the institutions that can do that over the long term, and continue to be responsive to the needs, rather than coming in just with a project to do something short term
Mhm.
to help people immediately. So that was really what I think we went through a strategy process in 2016, 2017, and we came to this mission that we support change agents who are building strong systems for health, education, and nutrition back at that time. And the support for change agents being our top kind of client, who we really think always want to think about, who is it that we're supporting? These policymakers, also private sector leaders and civil society leaders that might need to work together with policymakers to make change in the systems that we're supporting.
Mhm.
That was the driving force behind that mission and strategy shift for us.
Yeah. No, thank you for walking us through that. So, thinking about how this looks like in practice. So, there are people on the ground who are already trying to improve the system. These are the change agents that you mentioned. These are people in the government, in the civil society, private sector, all different sectors. And so, results for development, would you say, identifies these initiatives and change agents in the ground, and then sort of finds ways to support the work that is already being done? Or do you focus on building capacity? Do you focus on convening stakeholders, and sort of aligning support? How does this look like in practice?
Thanks. Yeah. Oh, I think a little bit of all of the above. And I would say we manage a number of different programs, and they really fall into two categories. One really, I think, plays to our strengths as a global international organization. We manage a lot of networks of peers, learning networks, where we can bring together, for example, policymakers who are all focused on achieving universal health coverage in their own countries, or people who lead vaccine delivery programs in their own countries. We've created networks that enable those leaders to come together, learn from each other, look together at evidence, think about some of the practical aspects of implementation, and actually create sort of new practical knowledge that they can then implement in their own countries, but also share broadly. And we find that approach to peer learning is really, really effective, both for kind of motivating leaders who, these are not easy challenges that they've taken on. So finding their peers, just as I did early in this journey, it can be really motivational. And it also, we find it's a great way to help to problem solve some of the real implementation challenges that people face. And that's a great complement to some of the academic research that might show what's worked in a particular place. But then people are like, well, how do we do it in where I am? And so we manage a lot of those kinds of learning networks. We also have selected key geographies. We think it's really important. We're kind of a globally connected organization, but we also really want to make sure we were locally rooted in at least some countries. There's a lot of countries in the world, and we can't claim to work in all of them as a mid-size global development organization, but we do have really strong programs in countries like Ethiopia, Tanzania, Nigeria, Ghana, Indonesia, and growing set of countries where we do have teams that are there on the ground, growing teams anywhere from 6 to 20 people in those countries, most of all of whom are from those countries. Some of them who've worked in government or worked in other entities, and the role that they often are playing is really to accompany leaders who are currently in office on their systems change journey. So we're really tried to be focused as much as possible on what are the priorities of the leaders in the countries where we work. And then our role can be to, for example, help to bring in evidence that has been generated globally or experience from different countries to help inspire thinking for how leaders might address their own challenges. It can be to help facilitate processes or even to coach leaders on how to facilitate a process that's going to involve all the right stakeholders, meaning that you're going to get the right voices in the process, including some marginalized voices that might not traditionally get at the table, that will get you to better solutions, but also will help with implementation because, as you well know, if you leave out certain stakeholders from a design, often the whole thing can fail because people will not be bought in. That was a lesson I learned back in the day when the U.S. health system reform failed back in 1994, just to go back to something we were talking about earlier. But so we're often really focused on I say broadly supporting country-led systems change, but in a variety of ways of bringing the evidence, helping with the stakeholder engagement to make decisions about what to do, and then also really supporting leaders in countries to on their implementation journey, and especially how they learn adaptively throughout the implementation process. How can they test out different approaches, see if they're working, and then make iterative improvements. So that's what we do, kind of broadly. And ideally, we are. There's a few countries, like for example, we've been working in Ghana for more than a decade. And I'm really proud of the work we've done to support the leaders of Ghana who have had a big vision for what they want to do with their health system. And I think Results for Development has been accompanying them along that way and supporting as they build new institutions, a new national health insurance agency, a new healthcare quality agency, support for new ways of delivering primary health care, and then helping them to kind of think through how all that fits together into a strong system. And they're definitely still on their journey, but it's exciting to see how a country like Ghana has moved forward. And I'm proud of the fact that we've been able to kind of support them at key junctures along that journey.
Absolutely. No, thank you for walking us through that. And it seems like there's like a fundamental shift in this relationship dynamics and in how you support rather than sort of bringing your own agenda. So I think the leadership is I can see is with the people in this case. So I think that is really great to hear. How did COVID impact this work? How did just not being able to visit places, say in person, or having to do hybrid work, um, did it shift anything in the way you were working? And does this have like implications for how you will continue to do this work?
Great question. Yeah, I mean, I think back to it's about 3.5 years ago that the world kind of shut down. And at the time, I was, of course, really nervous. Like, how is this going to impact us? At the time, we were, people were flying around the world. And to be perfectly honest, Bibek, a lot of our staff were, because we were a relatively new growing organization. We had more people in the United States than we did in the rest of the world, although we had growing teams around the world. I think COVID was obviously a massive tragedy for the world and continues to be. The legacy of it. I think it even if the virus isn't as being transmitted I think it's still being transmitted, but it isn't killing as many people around the world as it was a few years ago. But I think it still took its toll on health systems and education systems around the world, and we're still recovering from that. So that was a real tragedy. I think for us, it helped us see a different way to work that I think actually is very aligned with our mission to support change agents. We started hiring a lot more people in the countries where we work. We have learned how to work virtually a lot better, both through these networks I mentioned. There's a real benefit. There's a benefit to seeing each other in person, of course, and we've gotten back to doing that some, but I don't think we'll ever go back to as much flying around the planet, which of course is not good for the climate. That's a whole other topic.
Mm-hmm.
Um, but I think we've really learned how to work together virtually as an organization, and connect with each other all over the world really, really well. And we've also been able to um, build our country teams in ways that they can be the ones that are really supporting the leaders in the countries where we are. So that was a real change for us. And I'm excited that we're building this. We're trying to we've called it the Globally Connected International NGO that's also
Mm-hmm.
locally rooted. But we're trying to create a structure where we've got people all over the world who are, could have almost any role regardless of where they sit. It used to be we sort of had, and many other organizations had people that are kind of like headquartered in Washington, and then you had country offices doing country work. Now we've got people doing global roles sitting in countries around all over the world. So I think that's a legacy for us of COVID. The way we've structured R4D has changed because it opened up our eyes to how we could work more virtually as
Mm-hmm.
well. And then I think, of course, there's been a lot of continued sort of deep work and commitment to focusing on improvement of health systems and also education systems that was there before COVID. But I think, people have recognized the need to continue to double down and make sure we continue to make sure those systems fully recover from that huge shock. And that's some of the work that we're also doing.
Mm-hmm. Absolutely. I think the urgency is even higher now. I'm one of those employees who are based in Nepal for my case, and then working doing the headquarters job. I think that's one of the benefits that I've been reaping as well. No, that is great. So I think, thinking about how things have been changing also with COVID, where do you see development going? Does the future of global development look like in your eyes?
Wow, I wish I had a crystal ball to know for sure, Vivek. But clearly, I feel like in the last couple of years, there's been a lot more conversation among many global institutions about the need to focus on um, being more locally led. There's the terms that have been thrown around include locally led development, localization, decolonization for people that are a
Hmm.
little bit more political. Although I know a lot of my colleagues that are from low and middle income countries actually don't like that term. So we don't use it as much at R4D. But I think there is a recognition that the landscape, all of the different players, global players have been trying to dictate the agenda too much for countries, and that there's a need for to really respond to and let local leaders lead. I think there's also a lot of discussion about how global organizations have been the ones that have been the recipients of most of the global development funding and have been the ones that have built their own capacity, and that there's a need to really shift a lot of those resources to local national organizations. So that I think is a change. I don't know exactly how it's going to fully play out. I think there's always pendulums in every field. Things swing one way and then the other. I think it's a good shift that people across our field are really thinking about how to foster locally led development, and it's great that leaders in countries are really demanding this, and so I think they have been the key voices in this. How it plays out, I'm not exactly sure. I think there's a lot of good inclination again to put more resources and money toward local organizations. And this might be self-serving because I run an international organization that does not want to compete, even though we have local offices. The last thing we want to do is compete with local organizations. We do think there is a role for global organizations to continue to foster learning and connections. There are, I mean, the capacity you have to build up as an organization to be able to accept funding from certain key donors like USAID. It's really hard. I mean, we've gone through it as a US based organization, and we're still not totally there yet, right? It's really difficult. We're a $50 million organization with 180 people, and it's been around for 15 years, and the kinds of capacities you need to be able to accept money and make sure that it gets handled well, and do all the monitoring and evaluation and all of that is hard. So I think what we need, the future in the next few years to the next decade, I hope we will settle on a model that really does put local leaders first and really is responsive to their needs, while also recognizing that there is a role for international organizations to make sure that evidence is being generated and shared, and there are strong networks of practitioners who can learn from each other, and that we set up a model that works. I mean, I think for the foreseeable future, I hope there will still be money flowing into this field that is supportive of development efforts, but I think trying to figure out the right way to make that money flow so it gets to people who are making change in their own countries, and also does fund some of that, what I've heard someone recently call infrastructure for localization. I think that was Rose Maruru from EPIC, which is a great local organization that is working to try to identify local partners. She's based in Senegal, but she made a point at a recent event that there's a need for infrastructure for localization, not just money going to local organizations. So those are some of the themes I think that are playing out in global development. In terms of the how, I think the what is also a big question. I think we continue to think through what are the big priorities that countries should be focused on. There's obviously new technologies and the ability to harness those technologies. We manage the Global Ed Tech Hub, which is really focused on how education technology could transform education systems in low and middle income countries, trying to understand what works and how to get that into practice. I think with health, you mentioned COVID. I think we need to rethink where the resources are going to health, and understand what are the big health threats now. They might be slightly different than they were 20 years ago. Non-communicable diseases are becoming more and more, more of a threat in a lot of different countries. I'm a believer if we can create stronger systems for health, stronger primary healthcare systems, good financing systems, then countries will be able to make sure the resources go where they're needed in their own countries. There still may be a need for specific programs targeting particular diseases, but I think we can't not think about the foundational financing and delivery systems that enable countries to meet everyone's healthcare needs. And if all the money just goes into programs that are focused on this disease or that disease, then we're not going to get to strong systems. So I think there might need to be a rebalancing there.
Right. No, I think that part about helping build stronger systems rather than just, parts of the system, I think is really crucial. And I see, including results for development, many organizations sort of moving to that kind of work of supporting the broader system. And no, I think you raise some very important things about where the landscape of development is headed towards. And, we definitely see some positive trends in terms of localization and building infrastructure for localization, and the kind of brokering role that international organizations can play in terms of supporting with evidence and those sort of things. So I think it seems like the future is not all bleak. It's pretty hopeful, and as you said, I think the things are changing so fast that we have to be agile in terms of how we are thinking and sort of constantly learn and adapt our approaches. which I
Definitely. Can I say one more thing? I'm
yeah.
sorry, didn't mean to interrupt you, but I feel like there's one thing I didn't say before that I think is really important. I mean, I talked about R4D's aspiration to always be focused on local leaders. And then we also talked about these shifts in global development. I do think that we are constantly grappling with situations where we see the need and we talk to leaders in a country who want to be focused on one thing, and then the funding that we get is telling us, R4D, we want you to focus on this thing. And sometimes it's in good alignment, but we still see that misalignment at times between how some of the funders are acting and what they want us to do, and the way they give money for very kind of often overly short-term projects. And so that is, I think, a needle that we are trying to thread. We hope that we are supporting the field, and we try to give a lot of feedback to our funders too, and hopefully with some success. But I think continuing to navigate some of the structures that were set up decades ago, that even if the leadership and the people that work in those funder organizations want to change, it's hard when you have bureaucracies set up to support a particular way that money flows and
Mhm.
how decisions get made about what that money gets used. It can make it difficult for to be truly responsive to the needs of people and countries. So that's something we're constantly grappling with. And I wanted to just call that out
Mhm.
because I can talk about our aspirations, and I think we live those aspirations a lot, but sometimes it can be hard. And I
Right.
think that I hope that the landscape shifts so
Mhm.
that will get less hard for us and for others in this field. Anyway,
Right.
wanted to say that. Sorry,
No,
didn't
no,
mean to
no.
interrupt you, but
Thank you. Thank you for that intervention. No, I think that's very important. And thinking about how, well, I'm curious, how do you then navigate that situation when there's funders who have their own agenda, and then now you have to also be responsive to the need at the ground? How do you balance that?
that's a great question. I think, in all honesty, we have tried. I mean, there have been a few occasions where we've just said, no, we're not going to do that. We'll walk away from that money, um, because it's just not in line with the way we want to work. But I think our approach has been more to see if we can influence. I'll give a couple of examples. There have been times when donors have come to us and said, "Hey, R4D, we're really interested in learning about this particular phenomenon. Can you guys do some research and then, you know, report back to us?" And that's a very general example. But in those times, sometimes what we've done is said, "Okay, that's a really interesting. We agree that that's a topic that is important. What if we approached it this way? What if we worked in this particular country and we found, let's first find who is like the client for this information in this country, who really would use this locally, not just the kind of global
Mhm.
organization for your own strategy. And then maybe we can find a group that could actually conduct the analysis. Maybe it's a university, maybe it's a quasi governmental agency that does research. And we could maybe play the role of coach to them,
Mhm.
and support those leaders to do the work. And then we could try to make sure that once the work is done, that it gets back into a domestic process that would use that data for their own decision making. And I think we've had some success in those kinds of situations of like pivoting. The challenge is sometimes doing the work that way costs more. It'd be fast, and it takes longer. So
Mhm.
that's where the negotiation sometimes happens, is like, you wanted to do this in 4 months. That process is probably going to take 9 months, and it's going to cost more because, there's some work that we have to do, and then we would need to fund the time of others. So I think we try, when there's an opportunity where we feel like there's a real opportunity to make a change here. I'll be honest, sometimes we use what we call the foot in the door approach, where it's like, okay, this isn't perfect, but let's start working and let's see if we can, hold true to our principles and try to see if we can influence. We actually I had a third party help us do some research in Ghana. I mentioned we'd done a lot of work in Ghana a couple of years ago, and they interviewed a lot of stakeholders we had worked with. And I was really pleased when I heard some of the conclusions were that some of our partners in Ghana felt that we had really influenced the funder in that situation to make them more responsive. So that's like, I'm
Mm,
like, we're being successful if we've obviously we want to see systems change for the people of Ghana, but there's a small success if
mm,
we see a funder that is maybe being more responsive because we open their eyes or we encourage them to do that. So
right.
those are a couple of examples of how we work. But
Right.
I have teams come to me all the time, Bibek, and saying like, Gina, you talk about serving change agents and how the funders aren't our clients, but then like I feel like all we're doing is we're being responsive to the funder. So
Mhm.
it's hard. It's really
It
hard.
is definitely, and no, I really like that approach of being creative about how you make the case for a particular agenda, and then sort of transitioning to what's already there. How do you build capacity? How do you sort of balance both interests? And I think what you mentioned about having to balance transaction costs versus really making that impact, building capacity, and that taking more process in that direction. I think that is also something tricky to balance. But I think as we near the end of our conversation, I think I want to end by asking, where do you see yourself then in, say, 5, 10 years? Do you see yourself continuing on this journey of taking results for development forward, or something else?
Oh, what a great question. I just turned 50, Vivek, so I've been like thinking, you know, it's a milestone birthday where you start to ponder those things. Let me just say this. I love my job. Like I really love what I do. It is hard. I have days where I don't like my job, but I mean, generally, I really do love it, and I feel like I have every year changes. The job change. It's the same. I've had the same job title for 7 years now, but every year I'm focused on something totally new and different, and I think I've gone a little bit from the total head down and trying just to make this organization work, which is still the absolute bulk of my time. I am motivated. We talked about the motivation of like creating strong, equitable health systems and education systems. I'm also motivated by just creating an organization that is really effective, that the people who work for the organization, the people who work for R4D love their jobs, feel like they can be affected, that they feel supported. um, I'm motivated by the idea of trying to create a new kind of global organization that is truly has leadership that's truly diverse from across the globe, that is figures out a way to operationally operate across different countries. That's also not easy. That's a we haven't even gone into all that stuff, but and an organization that is a leader in the field for among others. There's a lot of other great organizations. I have a fantastic network of peers who are also really trying hard to create sort of the global development organization of the future. So I continue to be quite motivated by all of that, and I think maybe increasingly as I've done this role a little bit longer, pulling up and thinking more about how can I help shift the field. And I joined, for example, a group called the Modernizing Foreign Assistance Network, which is tries to influence policy in the US, development policy. So I'm doing a little bit more of those kinds of
Mhm.
things now as well. But I think for the foreseeable future, I love what I do. I'm not honestly interested in going and running any other global development organization. It's sort of like I think about it as like being like a parent. Like I love being a parent. I love my kids, but I don't really want to parent anyone else's
Mhm.
kids. So, and I love R4D and this organization. I'm really committed to this field and trying to make this field better. And I think that I will channel that probably through R4D for the foreseeable
Mhm.
future. Um,
Yeah,
but
no.
it's a good question that I continue to ponder.
Well, I think you answered it very well. And no, I think however you're doing it, you're definitely making a lot of impact in a positive way. So thank you for all the work that you do. And thank you so much for taking time to share about it with us today and with the Harvard Alumni for Global Development Network and sort of broader audience. Well, with that, I think love to thank you again, and we'll end this conversation.
Thank you so much, Bibek. And I'm excited to be connected with all of those Harvard alumni and others. I'm excited that you guys have created this forum, and I hope more alumni, just generally people from around the world, will get involved in this field. It really is a very rewarding field. And thank you for this
Mhm.
platform to talk about it.
No, it's a pleasure. Thank you so much. All right.
Bye bye.